Welcome to the Outsmart Burnout podcast. I'm your host, Dr. Zarya Rubin, a functional medicine doctor, an international speaker, and a burnout badass because I've been there myself. After walking away from my own high-stress medical career, I discovered how to break free from burnout to reclaim my passion, purpose, and joy. And now I'm here to help you do the same. From science-backed tips to time-saving hacks, and hopefully some aha moments that just might change your life. So sit back, relax, and let's do this. Dr. Erin Sheffield is a board-certified oral maxillofacial surgeon, speaker, educator, and advocate whose mission is to reshape the culture of surgery by amplifying the voices of women. She practices at Quincy Medical Group and is the founder of The Doctor Is All In, a wellness and leadership retreat for women in surgery and medicine, and is the co-host of the Resting Stitch Face podcast. I think actually that's the best podcast name I've ever heard, where she leads unfiltered conversations about the realities of being a woman in a high-demand specialty that is predominantly male. Dr. Sheffield's path to surgery was anything but linear. She originally studied marine biology with dreams of diving off the coast of California until a nudge from her twin sister pivoted her into dentistry and ultimately into oral maxillofacial surgery. As one of the few women in her field, she navigated a landscape with little representation and built the community she wished had existed for her in residency. She's also a mom of 3 who has spoken candidly about burnout, imposter syndrome, infertility, and identity in a profession that often asks women to check their humanity at the OR door. Her retreat, The Doctor Is All In, was born from a simple but powerful idea. She says, I created what I needed when I was in residency, a space to belong, a space to exhale. And oh boy, that is exactly what we talk about here on the Outsmart Burnout podcast. So I'm so excited to welcome you to the show, Dr.
Thank
Erin.
you. I'm so excited to be here, and that bio made me sound really cool.
You are really cool.
I should read that as my mantra every morning. Dr.
Yeah.
Erin Sheffield.
That's just my mission in life. Build up my guests because you guys are awesome.
I mean, that's a good strategy.
Yeah. I mean, so there's so many directions we could take this, but I think that we're going to dive into a lot of topics surrounding, identity and who we are before medicine, who we had to become in order to survive in medicine. That's actually a really interesting question that I asked an audience when I gave a talk at a medical conference. And I said, who did you have to become to survive medicine? So I think that's an interesting one. But before we get there, let's talk about sort of the origin story and the making of a surgeon. And you started off as a marine biology student. How does that, the fish and the swimming and all that translate into becoming a really highly specialized oral maxillofacial surgeon? And for people who maybe don't know what OFMS is, maybe give us a little primer.
Sure. Well, I was interested in science. I thought I wanted to be a biology professor, specifically marine biology. So I told people I want to be a marine biologist, and they thought that meant I wanted to be a dolphin trainer at SeaWorld. And that would be fun too, but that wasn't really the vibe that I was going for. So they didn't have an official marine biology minor at our school, but I took enough credits, essentially could have been that. And I spent the summer at the Stanford Marine Station in Monterey, California, taking classes, studying marine biology there on site, and I loved it. But I kind of had this realization, I'm very much a people person. And what I really wanted to do would be to dive down in those deep ROV submersibles, the ones that go really deep into the dark and find those crazy creatures. And I realized, there's probably only like 5 people a year that get that job. I don't know if I get that job. And so if I don't get that job, I'm probably going to be a person staring at snails in an aquarium my whole life. And I just knew that wasn't going to fill my cup like I needed, because I am very much like an extrovert, a people person, and being like in a lab setting by myself just didn't seem quite right. So I was having this moment of devastation where I have no idea what to do with my life path. My sister was like, "You should be a dentist." And I was like, I'd like never, ever, ever considered it. And I'd never met a woman dentist at this point. In Utah, there were very few women dentists. I mean, there were probably fewer women dentists in general, but I'd never met one. I'd never seen one. And so I always say it's as if you told me to be a welder. And not that I couldn't be a
Wow.
welder. Like I could be a pretty dang good welder if I put my mind to it, but it never come across my mind as, like, seeing myself in that role, and so, as I started looking into dentistry, I realized, "Wow, this is actually really cool science, artist, medicine type of vibe," and so I looked into it, and the rest is history, I guess.
Okay, that's wild. So that was your twin sister. Was she a dentist or did she just get this idea out of nowhere?
No, the funny thing is, we kinda joke now, she went on to become a high school counselor by training, and then has been in like career counseling and professional development for students in the university setting. And so she was a
Perfect.
pre-health advisor. So we're like,
First
I was your
client.
first
Yeah.
person that you advised to go into a health specialty. So, now she has a PhD in basically like medical hospital administration type of education. So she works at a PA school, helping with their programs and stuff there. So
Wow.
not the same, but just enough to
Yeah.
kind of cross over a little bit. So yeah, I was her first success story.
So then from dentistry, people don't realize, so you become a dentist first and then you become a doctor.
Yeah. So there are two paths in oral surgery. The first path would be to do a 4-year residency where it's just surgical hospital residency. And then there's a 6-year option as well. The 6-year option has a 2-year added on medical program. So you can become a dual degree MD and DDS or DMD as well. So about half of oral surgeons have that extra degree, and half of us who do not. I'm just a 4-year. The job is the same. Some people just like more time and to pay more tuition, I guess.
Yeah, yeah, we had a guy in our med school class. I think he was one of the oldest students, and he had done, I think, dentistry and then a master's, and then went to med
Well,
school, did FMS, and then we were like, "Okay, you're really smart and you really like school."
yeah,
But
yeah,
and then
exactly.
you do more and more and more training to do all of the, like, facial surgery.
Yeah, you can do fellowship if you'd like. A lot of people will choose the MD track because that opens up more fellowship opportunities. So, like craniofacial or plastics, facial plastics, or head and neck oncology.
Wow, amazing. So, this field is really not a field that many women go into, correct?
Correct.
Yeah,
Yes.
so did you feel like an outsider? Did you feel like you belong there? Or when did you feel early on that you were, like, either out of place or that you did fit in, and what was that like?
Yeah, I remember I can't find the article now, so I might have made it up, but I was almost done with residency. I thought it was in 2015, and I remember reading an article that said the number of board certified uh, oral maxillofacial surgeons who are women was only like 2.67%, something like that. And I remember being so
Mm,
surprised, like, whoa, I knew it was low, but oh, and now we're sitting at
well, that's
probably
really low, yeah.
8 to 10%. So that's a pretty big jump in, 10-year period, but it's very male dominated. And luckily, I feel like I always got along well with guys. I didn't have any trouble with that. So that wasn't too intimidating to me. But the bigger part for me was the lifestyle of like, can I make this work? I did want to have a family. Was I gonna be able to manage all of that? And thankfully, I had a woman mentor who, we just happened to have a unicorn woman oral surgeon at our university. And talking to her and seeing how much she really prioritized her family, but made it work and encouraged me. That's really what gave me the courage to go ahead. But I feel lucky. My residency program was friendly, and there were very few instances of any like overt harassment or discrimination, etc. But I think just the nature of being in a hospital and being in a residency, I think there's a lot of hierarchical, toxic, patriarchal type of systems, and then a lot of
Yeah.
guys that are maybe just kind of clueless about things that might be microaggressions or whatnot, and then you get things coming from patients too. So,
Mm.
there wasn't anything like horrible, but it's just those little moments that add up that just make you feel kind of different. And I was on another podcast yesterday just talking about one example. I was talking to a patient at the end of the day on the phone, and I could hear my chief resident in the back saying how annoying my voice was because it was kind of high. My phone voice is kind of like this. Hey, I hope you're doing okay, and he was in the background saying, I would kill myself if she talked to me that way. And I remember just feeling so
Stop.
embarrassed, and I felt like I had done something wrong, and part of that's a hierarchy, like, when people above you say you're doing something wrong, you are wrong, then you try to fix it, you jump through the hoops, make it happen, and so I just remember feeling really embarrassed, and I wish I would've been smart enough to well, maybe it wasn't smart, maybe it was smart that I hold my tongue, but, some kind of funny, like, "Well, coming from a short bro like you." I mean, there's things I could have
Yeah,
made fun of him about that you can't
right.
control, but there's just those kind of things, and again,
But
I think
it's
trying to
just, yeah.
mold yourself into what they want you to be is something that's really easy to take on.
Hey, quick pause. If you're a female physician listening to this episode, but your mind is racing, your shoulders are up by your ears, and you often feel like you have heart palpitations, if you're up late replaying a tough case from earlier that day, unable to fall asleep, if you're dreading your next shift and snapping at your husband and kids, you might even be starting to wonder, why did I choose medicine? Did I choose the wrong career? And believe me, I've been there. And I created something tailor made for you, the SOS session, Step Out of Survival Mode. It's a 90-minute intensive single session because when you're stressed and burned out, a long coaching program or endless trainings just feel like one more thing on your to do list that you can't finish. And I get it. I'm a Harvard trained neurologist who walked away from clinical medicine for many of these same reasons. In our deep dive session, we'll use my RISE framework. Recognize what's keeping you stuck, investigate your stress patterns, shift your nervous system, and finally learn to embody regulation as your new normal. You'll go from shallow breathing and dreading every shift to finally exhaling, being present with your family, and remembering why you love medicine in the first place. Go to drzarya.myflowdesk.com to learn more and claim your session. Okay, let's get back to the show. Wow, we see that double standard. I mean, we see it in politics. We see it all. I mean, like a certain very famous, very brilliant candidate, it was like, well, her voice is really annoying, or
Yeah.
her laugh is really annoying. And it's like,
Yes.
my God, like,
I made a
what
social
are we
media
doing?
I made a social media post the other day that was a little controversial in our field. It was out bone grafting, and I got so many comments. Like, half the people were like, "You're right." Half the people were like, "You're wrong." And one guy said, "But you have to talk in that annoying voice or something." And I was just like, I'm all for debating
Again,
like the
still.
research and different points of view, but when you're like making personal attacks about something I can't change. So I just said something back like, well, this is a voice I woke up with this morning, but you woke up this morning choosing to be rude.
He
So,
woke up this morning and decided to be an a-hole.
right. But now, I mean, evidently
Wow.
there's something wrong with my voice, but
Girl, yeah. It's just, yeah, the things that we had to go through in medicine, like the discrimination and the things that we felt like we had to change about ourselves
Mhm.
to
Yeah.
make ourselves more acceptable or more palatable or more quote unquote professional. I know we sort of touched on this before we hit record of like, you know, there's this idea in medicine that women sort of have to change and harden and put on armor, and we can't be moms, we can't worry about our kids or our life or any outside things. I mean, that just doesn't compute,
Yeah.
right?
Well, and it's so different. Our program, when I was there, it was very like family friendly program. And so all the men in the residency had children, multiple children, some of them many children. And then it was like,
Mm.
Sheffield, you better not get pregnant. It was like totally different vibe where like them having children is like
Wow.
a beneficial thing. Like they're stable, they're committed, they have good values. And then the women, it's like we have to prove like, "No, I never wanted children. I, like, had my tubes tied already. You can trust me." And when my podcast
Wow.
co-host, Dr. Sarah, talks about how in her 3rd year, so 3 out of 4 years, she got called in and basically got in trouble, and they said something like, "We hear you wanna be a wife and a mother. If that's the case, you should cut your losses," and she was gonna be in the Navy, "and the Navy's losses now and get out." And we're like, "That is so bizarre." For one, why would kicking a resident out in your 3rd year help the pro if anything, they should, like, eke you by because it's so hard to go man down in residency, right? Like, that's
Wow.
terrible. But that's the message, and I feel like even when you're interviewing, you have to be, "I'm 100% committed. This is all I ever want to do with my life. I'm gonna work to the bone, to the ground until I'm 90 years old and I get forced out of retirement having a stroke in the OR type of thing, you know?"
Oh my God.
And
And
there
wow.
was a post from either a senator or a congressman, I'm sorry, I'm blanking on his name, just the other day, where he said something like medical schools need to better vet the applicants to prove that they are going to be willing to work 20 years before they get out because of retention. And I feel like that's that same vibe. Like we very much have to prove our
Wow.
commitment, prove that we deserve to take up space in this specialty, promise to do all of the things. And I don't know, I can't think of anything else. Like if you want to go into banking, you got to
Oh, you gotta
sign this
prove
in
that, yeah.
blood.
Yeah, it is really sort of like a blood sign in blood contract that you're like, I am giving over my life to medicine. And that's really what I felt like I had to do. That it wasn't a job, it wasn't a career, it was a calling,
Yes.
and I was called to do it. And therefore, I was going to sacrifice everything in the name of being the best doctor I could be. And I felt like the more I sacrificed, the more I gave up, the more I just sort of like killed myself to be a doctor, the better I would be and the quote unquote happier I would be. But yeah, that didn't pan out. And in terms of that comment from that senator, I got to look that up because that's wild. Way to victim blame and not actually go deeper and try to figure out what are the systemic and societal factors that are causing physicians to leave medicine. I mean, we know that women physicians leave
Yes.
at much higher rates than men, and they leave about 15 years earlier than men. Well, why is that? Well, maybe because it's such an inhospitable environment and we're not allowed to have kids or a family. I mean, I didn't even get out of my training until I was 35. And then I had to start thinking about I desperately wanted kids, but it was like TikTok.
Yeah, and then the for infertility rates are hugely increased in women physicians and especially surgeons, and, I faced it myself and probably wasn't so much age in my bad luck, but you
Yeah.
see it a lot, and women having to feel like they have to choose one path or the other or getting forced the path because, well, we wouldn't allow you to have the support or whatever to do it earlier because it's training years and now it's too late, and that's really too bad.
It's terrible, and I think that we as women, we don't really understand the gravity of that. It's like, "Well, I'll just push it or I'll just delay it or it'll be okay." Like, we're superhuman. It doesn't matter. Like, I've given up my sleep, my sanity, my social life, my everything. I mean,
Yeah.
I didn't even meet anyone, because I had no life, and I
Yeah.
was really quite miserable because it was the wrong path for me, so I couldn't meet anyone. I couldn't date. I couldn't have a
Right.
relationship. I was
Right.
too broken, too burned out.
For sure.
So that's another, form of infertility. I learned that recently. I was like, "Wait, that counts?" And she's like, "Oh yeah, not being able to find a partner, that counts." I was like,
Yeah.
"Cool.
I didn't yeah, that's
That was
fascinating, but
my issue." And then my
yeah,
husband when I was
definitely.
40.
Yeah, that makes it so much more challenging. Yeah.
So you managed to do it though. You managed to have 3 kids and still be a surgeon, be a doctor mom, and so how do you do it?
I think a lot of it is just pushing off all of those expectations. And when you think about like, well, who's expecting you? There's these things we've taken on, but they've been ingrained in you. Again, just to even get in, I had to like prove myself. And I remember the first time I applied, I had applied twice. I only applied to one residency program, which is not usually how you do it, especially
Right,
when it's a highly
right,
competitive
right.
field. But my
Yeah,
husband was a MD, PhD student, and so he was on the long haul track and was gonna be in Iowa for probably, like, 15, 16 years, and I didn't wanna leave for, like, multiple years. To me, I'd rather
right.
be married and be a dentist than be not married and an oral
Okay,
surgeon.
so that answers my question of like, "Oh, do you have an amazing house husband who helps?" No, you have an MD, PhD husband.
Yes, yeah, he's a ENT, pediatric ENT doctor, so
Wow,
some of it, you just have to choose the right partner, and he's amazing, and we both felt like we wanna make our life how we want. We don't both have to work 100 hours a week. Why? We found a location, a practice that gave us a lot of flexibility, and that was our number one priority. We're in a small rural town that I never would have thought we would end up in a place like this, but it allows us to design our life how we want it to be, and that's been amazing. So I work 3 days a week. He works usually 5 days a week, but on days that I'm not home, he'll go in late and take the kids to school. He gets done early enough to pick the kids up. So we're just like making our schedules work how we want,
that's incredible.
aren't worrying about if we're not working enough or not. My partner's out sick right now, and someone's like, if you're so behind, like, obviously you need to work more hours. And I'm like, no, I don't.
You'll never catch up.
No, there will always be more patients trying to get in. I'll never catch up. So we, really just don't worry about what people think. And I remember when our residency friends were telling us where we're going. Well, I'm going to Stanford and I'm going to Harvard and I'm going to these cool places like New York City or wherever. Well, now they look at it and they're like, "Where are you guys going?" And now they look at us and we visit them at Harvard, or we visit them in New York City, and they're like, "How are you guys able to take time off to come here?" Like, because we
We have a
made a
life.
good choice. So, and then my husband is phenomenal. He really pulls his own weight. Like, we're true partners. And for example, I've been really busy building this side project that I'm working on, the retreat in this community and my social media. And so when I've been doing that on my days off, which are no longer really days off,
Right.
it's like it used to be, what should we have for dinner? And maybe he would kind of help me make something. Now I come home and dinner, he decided what it was and he made it, like most nights. And that's so amazing. And I always say
Okay,
he's
I
my
I
activity.
I need the secret for how to get that to happen. Because no, I'm definitely the director of all things
Right, yeah, but he's
food
become
and
our
dinner.
activity dir I call him the activity director. Like, he's the one that signs the kids up for dance. He's the one that makes sure that they got on the softball team. Like, I know none of that stuff. He'll tell me, "Okay, at 5:30, I need you to go pick up our daughter from dance, and then I'll pick up the other daughter at this time." Like, he's the one that knows the schedule and arranges all
Love
that, and so that takes off not just, like, a physical load, but, like, such a huge emotional load. So
Yeah, and the
he's
mental
definitely, like,
load
one
of
in a
keeping
million.
track of all that. Yeah, he really I'm like, he's making all other men look really bad.
He is, so everyone else needs to step it up,
Yeah,
but,
seriously.
like,
Yeah,
they're
we
capable.
yeah.
Like, you're a male surgeon, that's very capable, so, like,
My
you can
husband
figure
is a male
out.
surgeon. Yes,
Is he?
yes. Yes,
You can
he is.
figure out how
Yes.
to plan a five-year-old's birthday party. Like, I was out of town speaking at this conference in Mexico City recently, and it was, like, the worst possible time to be there were all of these, like, band concerts and choir concerts and dance pictures, like, so we had to go and be the dance mom, like, putting the hair up in a tight bun, like, doing all these things
My
that, like, dads
god.
aren't usually doing. It was my
How
daughter's birthday the day I got back, and she was getting baptized, and he, like, arranged the baptism and all of the things, and he made the flyers, and he helped organize the birthday party and, like, threw a birthday party, all of that without me being there. And, like, yes, men are capable of high executive functioning in the business world, They could be capable of that at home as well.
My jaw is on the floor right now. It's
I know, he's
amazing.
amazing.
And I mean, but that is what allows women to be successful because we're sort of being asked to do something superhuman. And it's like, you have to be all the things. You have to be the mom. You have to take care of the kids. You have to take care of the household. And you have to be some sort of super successful career woman. And something's got to give. Like that doesn't all add up. One person cannot be responsible for all of that. And so unless you have a partner who is going to be 50-50, you can't. So, I mean, truthfully, I'm not. I mean, my career has taken a huge backseat to parenting, and I'm okay with that. It's
Mhm,
not what
mhm.
I ever envisioned for myself. I didn't really envision a 1950s style relationship where I have dinner on the table and how was your day, honey? But it is kind of what works for right now. And
Right.
I know that that will shift when my kid is more independent and is
Yeah.
off in
I
high
think
school or college.
there are times and seasons, and
Yeah.
he's really stepped up just because I've been busy building this thing and he saw the need, and luckily he's the type that sees a need and he's very service oriented and wants to help. And I think we communicate too, where I definitely was the one doing the meals or whatever, but we've just kind of evolved as we've gone, and hopefully I'll be able to share a little more of the load because now I'm almost feeling guilty like I don't do enough. Like,
I love
wow.
it. I
But I'm
love it.
also sometimes too, I think like I'm not really that helicopter I'm not really. I'm not at all the helicopter type mom. I'm not really like the sit and play with the kids type of mom so much, and I have to be like, "Okay, surgeon mom, put it down for a minute and, like, go play with your kid for an hour," Like, to me, I have to, like, remember to do that just
Yeah,
because that
yeah.
achievement thing that got me where I am in medicine, but makes it hard to really be there in that home. Then I start feeling guilty, like, "Oh, I'm not I'm a selfish mom. I'm too selfish." And then I think, if I, like, had my daughters as adults in my mind, would I want them to be selfish mom and, like, take care of themselves and have their own hopes and dreams and wishes and all of that? Or would I want them to be completely selfless, haggard, running into the ground moms? Like, that's what we prioritize. That's what we,
It it it
saint our
it's a
mothers,
it it's such a damned if you do, damned if you don't
Yeah. And so I was
situation.
like, I don't think I'm actually being selfish. I think I'm being balanced, but because it's not overly giving to the point that I'm like losing it. That's what society tells us we have to do. Then I feel selfish. And that's not how it should be either.
Well, yeah, I mean, we're not allowed to prioritize our own needs or have our own identity as mothers or as physicians. So as a physician mom, I mean, it's you have a double dose of you don't exist as a human and you're
Mhm.
not allowed to have any, I mean, what, like a social life, outside hobbies, interests, any outside interests? Like what's that?
Right.
And so, was there ever a point when you sort of felt pulled in too many directions and you thought, like, I'm okay, I'm burning out doing all of this?
I mean, I get my burnout is like very day to day. Sometimes
Mm,
you'll go through like episodes, but it can just be like in a moment. And I find I can tell my burnout's going out the window because my compassion goes like, it's gone, And it's like those moments where I'll do
100%.
sedations in my clinic and it's a conscious sedation. So sometimes people will be a little squirmy and they'll be like, if I'm not feeling burnout, I'll be like, it's okay, sweetie.
Mm,
But if I am burnout, it's like, that's so annoying. Stop. Like that's how I feel in my head, So you're like,
right, and you can't say
okay.
that, of course.
Yeah, like, I never would say that, but it's just like, "Oh my gosh, ugh," And so I find usually the burnout for me happens when a boundary has been crossed. And it's
Mm,
when someone demands to get on the schedule and it just gets put on and no one asks. And if they'd asked, I would have probably said, "Yeah, let's take care of it." But when they just put it
mm,
on without asking, I feel
mhm,
very
mhm.
unappreciated and taken for granted. Or if the hospital, they aren't willing to pay to have an oral surgeon on call, and I don't really feed into that narrative anymore of, "It's my privilege to be able to operate there, so I'll take call." I'm not buying into that anymore, and so they'll send, like, a case. This lady had a huge dental infection, and it got all in her face, and she's been in the hospital for days on antibiotics, and now it's finally, like, tempered down a little, so get her in the next 3 days so you can like take care of the tooth part so it doesn't happen again. I'm like, did the doctor call me and say, hey, Erin, we're really in a bind. We know we don't have an oral surgeon on staff. We've got this patient. We would like to send him out, but can you help us get it in? Then it'd be like, of course. But they just like show up on my doorstep and like, I'm
Right.
booked out 6 months. How am I supposed to get
Yeah.
this
How?
patient in?
How? Yeah. 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 Yeah, it's that feeling that, like, you're stretched in so many different directions, and you're
Just that
being
one more
asked
thing.
yeah, and you're being asked to do impossible things, and
It's
you're
the
like, "Well, I
straw
can't
that breaks
bend
the camel's
time," and
back.
yeah.
Yeah. Like, I do
Yeah.
pretty well with, like, the standard stuff on the schedule.
Yeah.
When you just layer the things on top, that's when I lose it, and my poor nurse, like, "This patient's asking this, and this patient's asking this, and this lady you're sending somewhere else, but she can't get a ride. What do you wanna do?" And I'm like, "I don't know. I'm not the
Yeah.
ride person."
Yeah. Right?
And
Right?
now I'm feeling really frustrated and, like, I wanna help, but I don't know. I'm not a taxi service, and I can't solve everyone's problems, and that's when it gets hard for me. So
And
it's more about,
do
like, just the layering on and the lack of respect or
do you think that if
boundaries.
you were a male surgeon, it would be the same or it would be different?
Well, there's so much that would be different. There's so much that would be different. I got reported to HR recently for hostile work environment, which
Yeah.
I felt like was kind of a gut punch because my entire career has been hostile work environment. I was illegally fired from my first position out of residency as retaliation for taking maternity leave. And so, like, I've lived the legit hostile work
Wow.
environment. And it was all because I had a rotating nurse who asked me about, like, an order 3 separate times, just wouldn't give it, wouldn't give it, wouldn't give it. And I was fine. And even though I'm all for, like, please question if you have a question or it doesn't seem right. That's not what this was. It was like,
Mm.
"No, I think we're still gonna give it." I'd give my rationale, and then she'd be like, "Do you still wanna give this antibiotic?" And, like, "Yes, I would
Yes.
still like to give it." They're just because 'cause they're allergic to penicillin with the hives doesn't mean she's gonna be allergic to Ansef. We're just gonna give it. And when you ask me a 3rd time when I'm, like, wrestling someone's tongue and sedating a patient doing surgery, like, I kinda lost it, and I was just
Yeah.
like, "It seems like you're not comfortable giving it, and if you're gonna keep asking me, then fine, let's not give it." But there's no reason to suspect this person is going to have an issue. Like, I didn't yell, I don't think I was rude, I explained my mentality, but I was just like, "If you're not gonna give it, then let's not give it." And then after I even apologized immediately after, and I said, "Hey, I'm sorry, I was getting frustrated, but I appreciate you being here to help." And I still got reported for hostile work environment. I should have reported them for not giving
For
an order,
insubordination and, yeah, like, not following orders,
but
yeah.
they would have never done that to my
Wow.
husband.
No,
There's no
never.
way. And if they did, they would just been like, "You're right, doctor. Thank you for so clearly
Thank you so
explaining
much,
that."
yeah.
But, like, "Oh, and they won't that person won't come back to my clinic anymore," and then it's, like, kinda putting me on notice and, "Well, I mean, I don't want this to follow you, Erin, and become, like, a thing, and we don't want people just quitting around every corner because 'cause you're so hard to work with."
It's absurd. It's really absurd. It's
But they
almost
show
it's crazy.
They show that women have to build up a lot more social collateral, like in a hospital setting, clinic setting, to be able to ask things. So a man can roll up and be like, "Give a milk and molasses enema, bye," and the
Yeah.
nurse like
Sure
happily do
thing.
it. But for example, a woman might have to like bring donuts and spend 10 minutes and then like, "Do you think you'd mind? Like, I know you guys already did the blood draws this morning, but we really are gonna want this other one. So like, if you don't mind, do you think you could do that?" And those are the kind of things that we have to do to get some
Yeah,
of the
and that's
results.
that's exhausting because it is extra work, and
It
it is,
is.
like, every single task, every single ask, when it becomes more of a burden or it requires more hoops to jump through, I mean, that is how you end up burning out. And
Yeah.
it's those little things that add up, and they're just, like, so below the surface, or the microaggressions that come from everyone around you of not listening to you, not trusting you, not following your orders, not respecting you as a physician, as a professional. It's like that stuff is exhausting.
Well, and they're minor enough that if you complain about one little instance and you take it out of context, it seems like you're making something out of nothing.
Right. But
And
it's
you're
not
either
one,
being
it's a
gaslit
thousand. Yeah.
by the system or even gaslighting yourself. Because, like, when I was going through my lawsuit, it was like, I don't know, am I just being dramatic? Maybe this was, and I'm like, I have hundreds of pages of documents that are like very clear about what happened, and it's super egregious. The state of Iowa found probable cause that discrimination happened. I hear they like hardly ever find that, like I have like evidence, and I'm still going, I don't know. And I don't want to hurt their feelings or make them mad at me. Yeah. I don't want them to not like me because I said that wasn't fair and we're going to court, like it's
Yeah.
just a different vibe, I think, as a
Wow.
female.
So, yeah, oh my God, I love everything that we've talked about. So, tell me about what you are building as sort of an antidote, to use a medical term, for all of this, and tell us about the Doctors All In.
Yeah, it just started. I remember going to my first, I call 'em mega conference, like the association annual meeting. And I was so excited to go. It was my chief year of residency, and I was thinking, "I'm gonna meet some other women oral surgeons. I'm the only one in my program, and I can't wait to meet some more women. This is gonna be a great opportunity." And I remember walking into these giant auditoriums and hardly any women at all, and then when I'd see them, I'd walk up to them, and their tag would say allied staff, so they're like a dental assistant or a
Right.
nurse or a office manager,
My God.
or I'd even start talking to them and be like, "Why are you talking to me? I'm just a nurse. Ew," So I remember
My God.
feeling just really alone. And then I remember, I'm like feeling like imposter. All these really cool oral surgeons. I'm just this dumb resident. And I hope people don't notice how dumb I am. And then I remember even walking up to faculty members and being like, oh, phew, like people from home. And they kind of blew me off too. And so I felt really alone. These meetings just tended to be talking about surgeons doing, like, the biggest, baddest things they could be doing and not really the things that I'm even doing at all, like fellowship level stuff, and I'm in private practice, and so it just left me feeling really isolated. It wasn't filling my needs at all, and so I remember when I finally started getting on social media, I started meeting other women in the specialty, and then I'd go to these events, and they'd be there in person, and it was like a whole different vibe, and I just remember thinking, "I wish we could do this for a whole weekend." Just us. And so I thought, well, why couldn't we? So they built the Doctors All In for that. So it's a retreat. And it's not an academic. We're not talking about fibular free flaps or cancer or trauma. We're talking about wellness, like holistic wellness. So the whole idea is come and take care of yourself so you can go take care of everyone else. We're talking about business principles, leadership principles, personal, mental, and physical wellness. And then we're mixing in community building activities like a ropes course and some spa time and all of that. So it's just kind of a come and detox and then go back feeling energized and rejuvenated, building community.
I love that. And I mean, it is so needed because of everything that we've talked about. It's just like there aren't enough opportunities for women to come together and be supportive and share and and be ourselves,
Yeah.
you know? I
My
think that that's what's missing.
My MC for the year, this last one, had to bail because her mom died, like, the day before. It was so sad.
God.
And so I was kind of in a jam, and so I invited my twin sister to come and be my MC, and she did great. She did a great job, but I remember her saying, like, "This is so surprising to me, like, I see so much insecurity in this room, and yet I'm looking at these women who I just think are, like, the baddest baddies around." And they're like, to see how they feel about themselves compared to what everyone else is thinking is really powerful and interesting. And so I think there's part of that I hope is that we created that safe environment where people could let that armor down and could, share the vulnerable side, which is still, despite all the amazing things I'm doing, I'm still not always sure if I'm okay. I still don't
Right.
always know how to navigate all of this.
And I mean, I think it's almost like the more you've achieved and the more you've accomplished and the higher up you are as a woman's, the more sometimes that you doubt that you deserve
Yeah,
to be there.
right. And so one of the women I've been so impressed. I've been watching her since then, and she kind of got thrown into practice ownership earlier than she expected and was feeling really nervous about that. And she's in my monthly coaching membership program, and she's just taken off. Like, she's getting on social media and she's having a lot of success there, and she's building out her website and she's making empowering changes there and also like in her personal life. She said, like, coming to this really opened me back up. Like, it helped me find who I lost. I lost myself. I didn't recognize myself. And that helped me find myself and give me the confidence and the desire to like push through and like build something. And so that really was like the biggest testament. Like, yes, that's why we're here. We're trying to
Because we do lose
find ourselves
ourselves.
again.
Yeah, we lose ourselves in medicine and we lose ourselves in motherhood. And we're just like, who even am I anymore? And then you get to like midlife, you get to perimenopause. And that's a fun ride, let me tell
Right.
you.
Right.
And then everything goes out the window, and you're just like, I don't know who I am or what I want anymore. And those things change. And am I allowed to want different things?
And I think
And
that
yeah,
achievement and caregiving combo is probably especially sinister in a way because usually achievement's for yourself, but I think it becomes more of a prove yourself and then you're always putting everyone else first. And so it's this kind of weird push pull where now we're achieving for other people. And so if we try to pull back and take care of ourselves, we feel guilty. And I
yes.
find the women surgeons, especially, like need permission. They need permission to do things for themselves. And sometimes it's like the silliest thing. And I remember like, "Oh, the cost of this retreat's a little high. Why is it so high?" And then the same person will come and miss the whole first night and leave the whole last day. So they come for one full day. And I'm like, you were worried about the cost, but then you missed half of it because you
Like,
couldn't possibly." One woman said, I would love to have come a day early to, like, relax and take advantage of the resort,
yes,
but I
yeah.
couldn't possibly do that. And we're like, "But you could.
But you could.
But you could."
I think there is a lot of mental gymnastics or hurdles or like these barriers that internally that we set for ourselves that we have to overcome. I mean, it's like when you have an animal in a cage and you open the door and it won't go out.
Yes.
And it's like, okay, but you could. It's just a question of actually shifting your perspective and your mindset from I can't to, well, maybe there's a way.
Yeah, I love that analogy. And you talked about armor before. I think that vision is so powerful because I think, like, we had to put on armor to protect ourselves and to make it through. And it did. It kept us safe, but there's negatives to carrying armor. It's
Mhm.
heavy. And you can't see who you are under there,
Yeah.
and
You
you're
don't
kinda
feel
slugging
anything
around.
through it.
And so we continue to carry that armor with us when we don't maybe need it anymore, and you think of the weight of that armor and the cost of that armor and what we're missing out on because we carry that with us.
Oh my gosh, I have absolutely loved this conversation. I wasn't sure which direction it was going to go in, but it went in all of these amazing places that we needed to hear about and talk about. There is a fun section at the end of the podcast called Rapid Fire Round, where I
Woo.
ask you just like some quick questions. And sometimes they're actually a little bit deep, but
Okay.
fun. And you just first thought, you know, and it's like first thing that comes to mind, last time you took a real day off, and because you said you work on your days off, what did that look like? You can't think of it.
Well, part of that, again, I'm not that person that can't put it down. Well, I can put it down till it's my bed, and then my bed becomes my boardroom, and suddenly I'm solving all of the world's problems. How about this? Yesterday, I was supposed to be working, and I woke up at 5 a.m. puking my guts out. And that's the worst part of a surgeon with a full day of surgery, right? Because you're like, what do I
What do you
do?
do? Yeah.
Am I gonna sleep it off for another hour and magically be better? I need to call and cancel because, like, a cold, I feel like a lot of times you can push through, but, like, if you're, like, rushing off to the toilet and you're in the middle of a sedation, that's not okay.
No.
So, I was trying to decide what to do, and the ironic thing is I was going to make a video before work that day. There's this trend going on social media right now, and it's like I have a stomach ache because I haven't ate, and then you do a transition looking good, and now I ate because that's, like, slang now for, like, looking good, and so I was gonna do that, but, like, you woke up feeling sick, but I have clinic at 8. Oh, well, so I'm like, "Am I manifesting this to the universe?" So I ended up canceling my clinic until, like, 10 a.m., which that's hard for me, so that's me, like, kind of answering question, taking a little time off, and then I'm like, "I think I'm okay, I think I can make it for a few hours," and then I was cutting off clinic a little early also because I had another meeting, and then this is where it backfired. Also manifesting. I made a video just, like, the day before about the first day in the operating room. I was an intern trying to get into, like, a full residency position, trying to impress people, and I peed my pants in the OR because I passed out. So, I was talking about how embarrassing that was, and then I'm sitting in clinic, and all of a sudden, I thought I was passing gas, and I completely soiled my pants.
Okay, girl, this is amazing. I can't believe this answer to this question where I'm like,
No, this was
what did
not
you
the
do on
right.
your day off?
So, no, so I kind of took half a day off yesterday. But then I'm going, "What do I do?" At least when I peed my pants in the OR, the locker room with, like, new scrubs was close by, but I only have my scrubs. So I threw my underwear away. I tried to clean up as best I could. I was wearing a gown, so hopefully no one could see, and then luckily I had a very convenient no-show. I had another patient that wasn't answering the phone, so I said, "Call him and tell him he can't come." And then the 2 patients that were in
My God.
like, on deck, I just hurried and got that done, and I was like, "No one can smell me, can you?"
I I
But
can't even.
I
Girl,
think that's a demonstration of, like, how we put everyone first, and then here I kind of was trying to put myself first, but then I'll come and do it, and then, like, clearly I made the wrong choice. Yeah,
yeah, my husband, I think, has, like, thrown up or left the OR to throw up and then, like, gotten IV in between cases where and I was like, "I'm
right.
sorry, what?" He's like, "Well,
Yeah.
I had to finish," and
You make it happen, but when your
my God.
pants smell terrible and are all wet and dirty, and it would take, like, 45 minutes to go home and change, like,
Okay, this is the best rapid fire ever. I
I'm
can't
sorry I
even.
went there,
Okay,
that probably was not.
this is amazing. Okay, we're gonna shift gears. I know you have some other passions outside of medicine and motherhood. So scuba or lacrosse, what if you had to choose?
Well, we don't have lacrosse in our town except at our small university, and we tried to sign the girls up, my daughters up for a little lacrosse camp they were doing, and they didn't get anyone else to sign up, so they let them come, and they, like, did, like, a mini thing with them, and we got to watch their game, and that really reminded me how much I love and miss lacrosse, so maybe since that'd be, like, a daily thing that I could do, maybe
Yeah,
lacrosse, yeah, but
yeah,
I miss it.
yeah. Best thing about having a twin.
I think being an identical twin, and at least the bond that we had, there's no possible way to replicate, like, the closeness that you have with someone like that. Just we had the same genetics, we had the same parents at the same time in the same environment, we're always together, and so that, like, level of empathy and understanding is just wonderful. It also makes it challenging because my sister lives thousands of miles away now, and I'm always just trying to find that fulfilling friendship that is very hard to find.
Girl, my sister lives in Perth, Western Australia,
Yeah, that's
so
far away.
it's not great. But and you have twins as well, right?
Yes.
That's wild, wild. And best thing about being a twin mom.
I mean, only having to be pregnant one time for 2 babies. Although, I also think that twin pregnancy is much harder, and so maybe you pay
Yes.
for it, so
Yeah, yeah, it kinda evens out in the end, but oh my gosh. What do your kids think you do for work?
I think they know I take out teeth, that's probably what they would say.
You're the tooth fairy.
Yes. I always say I'm the reverse tooth fairy, you
Reverse
pay me to take away the tooth.
teeth. Oh, that's so funny. What is one thing about the culture of surgery that you would change tomorrow if you could?
The thing I always say is that your most authentic self is the best thing you have to offer patients. And when I was in residency, since I only saw men surgeon primarily, I found myself trying to model my behavior off of their behavior. And what I thought was surgeon culture, doctor culture, a lot of it was just like dudes being dudes.
Yeah.
And so I wish there was just a little more space for like, let's get rid of the stuffy definitions of professionalism and allow people to be like their full, authentic self, whether that's being warm and open or empathetic or willing to cry. All of those things I think are valuable. Now, if you're putting that on and that's not you, like, I don't want you fake crying with the patient. That's not appropriate, I don't think. But if that's who you are and that's appropriate in the moment, like it feels good to you and to the patient and the relationship, then I wish we were a little more open to those experiences and like a wide spectrum of personalities and hair preferences and things like that.
Yeah, I mean, I remember being called into program director's office to be reprimanded about something because I was very much outside of the box, and I was like, "Oh, yeah, hang on just a second. I have to put down all of these gifts that I got from patients. Just hang on, hang on." And I had like cards and chocolates and I was like, "Just okay, so yeah, so tell me again why I'm not a good resident or whatever, like I'm too emotional. Okay, sorry, wait.
Right.
Let me just put down all the gifts."
Yeah,
I
exactly.
feel that one. Yeah. Okay. So, last but not least, so if there is a high achieving woman listening to this podcast right now, or like maybe even a surgeon, and she's running on empty, what is one thing you want her to hear before she tries to go back into her day?
I think the biggest thing is you're good enough. You're doing a good job. And you don't have to do everything, and you don't have to carry everything yourself, and you're probably doing a lot better than you think you are, and you're doing okay. You're doing great.
That All right. I know that when folks listen to this episode, they are going to want to find you and learn more about you and follow you on social media and check out The Doctor is All in Retreat and maybe check out the Rusting Stitch Face podcast. Where can people find you?
Yeah, I am on TikTok, Instagram, and LinkedIn as Dr. Erin Sheffield, DrErinSheffield. And then the Resting Stitch Face can be on pretty much all major hosting platforms and on YouTube. And then if you want to go to our website, it's doctorisallin.com. You can find the retreat and our monthly membership there.
Awesome. We will put all of that information in the show notes. And
Thank you.
if you love this episode, which I'm sure you will, because I love this, is like definitely up there with some of my favorite episodes because we covered a lot. We got real and raw here in the best way. Please like the podcast, leave us a review, and share this episode with a friend who could use it. Because if you have another colleague or friend who's a woman in medicine and is just like, what the what? This is the episode for them. And of course, as always, remember that burnout is not your destiny, it's your wake up call.